Hi guys, good afternoon. This is Miss Henderson and today I'm coming to you with another simple video on NCLEX style questions. So today's video is all about how to answer NCLEX style questions. So if you like this video, please give it a thumbs up and subscribe to my channel so you can receive more informative videos. Please leave your comments and concerns and thoughts below this video. Thank you. So the first question we have here, a nurse is obtaining a history on a geriatric adult. Which finding will the nurse most typically find? Lives in a long-term care facility, lives with a spouse, lives in divorce, lives alone. So the correct answer is B. Most geriatric clients, elderly patients, they like to live with their spouse. We know that patients feel more comfortable in the comfort of their own home. So living in a long-term care facility, which is a nursing home, is not an ideal situation. So it's always better for the older person to live with their loved ones. The second question we have here is that an older patient has fallen and suffered a hip fracture. As a consequence, the patient family is concerned about the patient's ability to care for herself, especially during this convalescent phase. What should the nurse do? So the correct answer is D. Provide information and answer questions as family members make choices among care options. So it's always important to provide factual information. It's critical. You don't want to provide any information that is, inconsistent with the care of the patient and giving them false hopes. You want to provide information and support for your patient in an honest and in a very factual way. That's the rationale for that question. We have another question here. The nurse is caring for a patient with leukemia and is preparing to provide fluids through a vascular access IV device. Which nursing action is a priority in this procedure to minimize the transmission of infection? So this question is a priority question relating to infection control practices. Reviews the procedure with the patient. Of course, we have to inform our patients of everything that we're doing. We have to explain. We have to position our patient comfortably for every procedure. We have to gather the available supplies to perform the procedure. But the priority question, this is a priority question. The main answer, the priority in this question is that maintaining surgical aseptic technique is critical in preventing infection. So the correct answer is C. We have another question here. The nurse is caring for a patient who is at risk for infection. Which action by the nurse indicates correct understanding on standard precaution? So the correct answer here is wears eyewear when emptying the urinary drainage bag. So the correct answer is D. It's important to wear the appropriate personal protective equipment, PPE, when handling body fluids. That's the correct answer. We have another question here. Which complication is a nurse trying to prevent by encouraging deep breathing, exercise, and the use of an incentive spirometer? Atelectasis, hemothorax, bronchitis, asthma. So we know the complications that that are associated with bed-bound patients are atelectasis. Also, patients can develop pneumonia due to the pooling of secretion in the respiratory system. So a lot of times we're trying to promote good pulmonary hygiene by encouraging our patients to take deep breaths. Also, the use of an incentive spirometer will greatly decrease the incidence of atelectasis or pneumonia. So the correct answer is A. Have another question here. Which nursing action will reduce sensory deprivation? Turning off lights, arranging for meditation, providing scheduled activities and visits to the room. Schedule frequent rest periods. So the correct answer is C. Which assessment finding is most critical in a client who is currently restrained with mechanical wrist restraints? So we know the indications for restraints are patients that are combative, patients that are harm to themselves or others, or patients that maybe that are on a ventilator, have a trach, or trying to self-extubate themselves due to the agitations. A lot of times the doctor may order a mechanical wrist restraints. So when a patient has a wrist restraints, we have to monitor for circulatory compromise. So the correct answer is hands are cool to touch. So we have to also monitor the skin integrity. We have to monitor the temperature of that extremity. We have to remove the restraint at a certain time, depending on the protocol of the facility. Some facility requires to remove every 15 minutes or 30 minutes and assess and do a neurovascular assessment. So the correct answer is B. What risk factor is associated with immobility? Decreased cardiac output, decreased lung expansion, renal calculi. So the correct answer is all of the above. Because when patients are bed bound and not moving around, they have a decrease in cardiac output. A lot of times they may suffer from orthostatic hypotension, their blood pressure drops because of they're not moving around, they're not coughing, they're not deep breathing. They might have secretions pulling in the respiratory system, so they might have decrease in lung expansion. They also at higher risk for developing renal calculi, so that's why D is the correct answer. The nurse is caring for a client who suddenly becomes agitated and tries to remove a peripheral venous catheter. What is the nurse's first action? So this question is also relating to prioritization. So assess for the cause of confusion, call the provider for a restraint order, try alternative to restraints, have a nursing assistant stay and monitors the client. So as we follow the nursing process, everything starts with assessment. So it's important that you go and you do a complete assessment of the patients. It could be a various reason why the patient suddenly become agitated. So the answer is assess for the cause of confusion. Maybe the patient blood oxygenation is low. Maybe they're hypoxic. So it's always good to assess your patient first. So the correct answer is A. In which situation should the nurse wear a gown? A client has human immunodeficiency virus or hepatitis. Client hygiene is poor. Client has intact skin. Blood or body fluids may get on the nurse's clothing. So D is the correct answer. What are some components of neurovascular assessment? Pulses, color, temperature, all of the above. The correct answer is all of the above. When you're conducting a neurovascular assessment, you always assess the patient's pulses. You check the color of the skin. Is it erythemic? You check the temperature with the dorsal aspect of your hand. Is it warm to touch? Is it cool to touch? If it's cool to touch, that will indicate that it has poor circulation. The nurse is working with an older adult in an extended care facility. What can the nurse do to support the appetite and nutrition of the client? Maintain good oral hygiene, request a blend diet for a client, mix all foods together at mealtime, dental consult. The correct answer is to maintain good oral hygiene. Have another NCLEX style question here. An older client in good health and is in no distress tells the nurse, I don't seem to enjoy my food the way I used to. I feel like everything has less smell and taste. What is the nurse best respond to this information? The correct answer, diminished senses are normal findings in some geriatric adults. Have another question here. The nurse is caring for a patient who has just delivered a neonate. The nurse is checking the patient for excessive vaginal exudate. Which precautions will the nurse utilize? Contact. Questions, concern, leave all comments below. Thank you for looking at this video, and please subscribe to the channel for more informative video. Thank you.